Assalamu alaikum, may peace be upon you. In this video, I am going to tell you about Miller's framework or pyramid of assessing clinical competence. In 1990, Miller GE described his Miller's pyramid or framework of assessing clinical competence. It is such a paradigm framework. It has passed through the test of time. So much so that it is not limited to clinical competence. It is being used in other competencies also. Therefore, we can simply call it Miller's pyramid of assessing competence, and we are using the word pyramid because in the classical paper it is projected as a pyramid. It is projected as a pyramid because there are levels of competence. Two words need understanding first. One is assessment, other is competence. Assessment is done of a living. So therefore, students is assessed, teacher is assessed. Evaluation is done of non-living. A program is evaluated, a course is evaluated, a workshop is evaluated. A lesson is evaluated, may it be a lecture, may be a small group discussion, may be a practical, may be a bedside teaching. Clinical competence, it's a very good definition which I saw this UK Nursing and Midwifery Council told us. The overarching set of knowledge, skill and attitude, the overarching set required to practice safely and effectively without direct supervision. This is competence. This competence has levels. At the lowest level is knows. And then becomes the next level of competence, which is knows how. And then is the next level of competence, shows how. At the top is the does level of competence. By knows how we mean that the student knows the information related to knowledge domain of learning, the information required to perform the skill related to skill domain of learning, and the knowledge which is required to be internalized to learn attitude domain of learning. Knows how means okay, now he has the information, but he knows this thing when and how to apply this information in different contexts. Obviously, in shows how, he shows what he has learned till now. And he shows this thing to a person, and person is the examiner. So therefore, he shows how it is to show how to apply information in an examination setting. And after that, once he is certified by the examiner, yes, we are sure he knows this thing, he has this competency, now he can go on independently, and he does in actual workplace. And from all clinical perspective, we know this thing, he is safe now. Let me give you an example of driving. If I want to learn, have a competency of driving, first I should have knows how. I should have the information which I can get from lectures, small group discussions, there are driving manuals, there are car manuals, and there are rules and regulation books, and then driving car under the supervision of an instructor who is sitting beside the second seat. Then shows how this is in the driving test. And does is, once I have passed the driving test, I am driving on my own. These two knows and knows how can be very easily assessed by MCQs, short answer question, short essay question, table viva, and that is what exactly they do. For show how, it has to be performance-based examination. Actually, in the police department, there are stations. And these stations are objective, structured, task examination, and the task is some part of driving. And does is obviously the police record. Just to give you an example, for knows and knows how, one can write questions like this. define red rule of red light if we are asking a short answer question. It could be list steps of starting a car if we want to talk about a short essay question even. In performance based, the question could be demonstrate parallel parking. And in does serve challan, the record of that is there. This level of competence of Miller's triad helps us to decide in a curriculum which could be across a year or across 5 years what we want to teach the students. And we know this thing, the first level to achieve is level of competence of knows and knows how. That is why pre-clinical year, the emphasis is on knows and knows how of the subject which we want to teach. And in clinical years, the emphasis on shows how, and then house job and PG, it's the does. Now you will also understand, if you do an analysis of the professional examination papers, in first, second, third professional, there are a lot of MCQs, short answer, short essay, viva, practical. Whereas in clinical years, there are short cases, long cases, OSCE and practicals. Exactly this is the reason why Pakistan Medical Council has mandated and made it compulsory in final prof in clinical papers, short case, long case, OSCE should be there. And we can't make it out. In house job and postgraduate training, there are different things. You have a patient management record of the, which is going to speak 360-degree feedback from the colleague, from the nursing staff, from the administration, from the patients. Incident reports, DOPS, direct observation of procedure skills. This can be used here also. Portfolio. The curriculum implication should have become obvious to you by now. Therefore, if you see this thing, as we are going from first year, second year, fourth to the final year MBBS, in the initial year, the predominant in knows and knows how, and there is also a small component of shows how, which is more in second year, more in third year. Whereas in fourth and final year, there is more emphasis on shows how, and major component is shows how, long how, and these things, and small component of these. If you reverse this thing, you're not assessing the students well. Thank you very much. See you in next video. Bye bye.